Hey, welcome to another Spotlight on Health. I'm going to start off like Steve Harvey, honey, the Family Feud. I'm your man, Curtis Akins. This is my one-man, Paul Akins. We have another good one for you today, Spotlight on Health. January is Thyroid Awareness Month, honey.
Yes, thyroid. And there is so many people who are suffering from hypothyroidism.
Yes, that's right. And we're going to zero in on, because there's many things about the thyroid, we're going to zero in on one particular thyroid condition, which is hypo underactive thyroid, all right? And more women than men, by 8 out of 10 are females.
Wow.
So they think it's a hormone issue as well, but because of that. So before we jump into that, let's jump into our disclaimer.
Yes,
we're going to go right into it, all right?
yes.
So let's go to our disclaimer at this time. The information presented is not to diagnose, prescribe, or treat, but to educate only. We advise that you consult with your primary care physician before incorporating any complementary, integrative, and/or alternative lifestyle medicine. All right?
So I guess my first question then on this one would be, is this exactly what would the symptoms for hypothyroidism be? What would someone expect or experience?
Okay. There are many, because this gland, honey, sometimes called the, quote, master gland. The master gland. I mean, it controls a lot of bodily organs, functions, glands, and even systems. So let's go to our next slide. This is just a sampling if there is hypo underactive. That's what we're emphasizing on this presentation.
Okay.
So, of course, the first one is weight gain, right? Because the thyroids also produce hormones that regulate metabolism and so energy. So, of course, people tend to gain weight. Hair loss, even dealing with the skin problems with that as well. Tired feeling, there's low energy, right? It affects the digestive system. So you have digestion, particularly constipation. We have cold intolerance. Remember now, the thyroid promotes hormones to produce energy and warmth and heat. So a lot of people, I'm good, but no, you're cold intolerant, so your hands are cold, the feet. Even mental decline, mental fog.
Okay.
All this is dealing with underactive or hypothyroidism, all right?
Okay.
So that's why sometimes, thanks for that slide, it's called sometimes the master gland, because it really produces and controls a lot of organs, glands, and even systems throughout our body. If it's not working properly, it increases the risk of cardiovascular disease, heart attack, stroke. The thyroid, the master gland. Yes, the master gland.
Wow. And it's not even that big.
No,
when you
it's
think
not.
about the size of that gland itself.
Butterfly, right below the Adam's apple, yes.
Yeah. So I know we must have an animation to actually kind of show this a little bit further.
Yeah, so we have a little animation because there's two main hormones. So let's put on your little thinking caps. Two main hormones, all right? Let me just, before they show the slide, T3,
Okay.
T4. T stands for, they guessed it, thyroid. The 3 is 3 iodine atoms. 4 is 4 iodine atoms, because dealing with iodine, all right? So let's go with this animation at this time, and I'll just walk this through at this slate, go with this animation, all right? So here we go. Here's the T3 and the T4 is going through the body, and so therefore it's going to affect a lot of organs and glands and systems in the body. Everything's working properly.
Yes.
However, if one of these hormones begin to drop, then you have problems with a lot of things in the system right there, all right? So T3 converts into T4, but when those things are not working properly, then therefore a lot of problems happen when that first slide about the problems as far as weight gain, you know, cold intolerance and metabolism, mental fog, etc. So these hormones, these two main hormones go throughout the entire body to maintain equilibrium, metabolism, and energy as well.
Wow.
Yes.
Well, I guess you need to get that exam done, because I remember some years ago.
Okay.
Some years ago, I had a regular physical exam.
Oh, yes.
You know,
Okay.
during that physical exam, one of the things that did show up was the fact that my T3 was acting up. And when he did the score was high.
Yes.
Where it should have been lower. It should have been its normal range. And I remember my physician saying, okay, you know, when you're at the doctor's office, they always, when they find something,
Yes.
they always want to prescribe something.
Right, that prescription pad coming out, yes.
So I'm that girl that when they start prescribing stuff and they start saying things to me, I'm always like, hey, I would like to just, I got the information through my blood testing or whatever's going on. Let me go ahead on and work on this.
Okay.
You've already identified it. Let me go on and work on this first, and then let me come back. And they normally say about 3 months.
Yeah,
3
yeah,
months
new
from
blood,
now,
yeah.
you can come back, you know, and check your blood and see what happens,
Okay.
you know. And of course, what they were prescribing, I was definitely not happy about because we're going to talk about that. That was
Yes.
the side effects. The minute I hear about the word side effects of anything I'm taking, I'm like, hold up,
The
wait a
red
minute,
flag
wait a
just
minute,
start flying high.
Wait a minute. So for 3 months, and so we began working on some things, other alternatives, and in 3 months,
In
when
3
I went
months.
back to my doctor, my physician, my score was all the way back
Yes.
to normal.
Normal range.
Okay, and so I know that it's really important when you have something going on to take care of what's going on,
Yes.
but then also knowing some other things that might be available to us. So what my thing is when we talk about that, the natural, of course is where we're going to go with this, or what are some of the forms of the different types of treatments, first of all, that they're going to ask you to take?
Well, let's first talk about the testing.
All right, let's do that.
So let's look at the testing because this is important based on that medicine. Let's go to our next slide at this time about the testing. So we talked about the T3 and T4.
Yes.
T stands for thyroid, 3 iodine atoms, 4 iodine atoms. So these are 2 hormones that go through the body,
Right,
right?
right.
To make sure the body's working properly. But honey, God built into our system in our brains something that will stimulate these hormones to move. Here you have the thyroid stimulating hormone,
Okay.
TSH. That stimulates the T3 and T4 to do their job. So in testing, they're going to test these T3, T4, and the free T3 and T4, and also TSH, thyroid stimulating hormone. Your TSH, the normal range was a 0 to about 5. I think yours was like a 9. So, but that's the test right there. And sometimes, most tests, they will just give you on your lab just the T4
Yes,
and the
yes.
TSH
Right,
on
right.
most labs.
Right.
But at least they're going to test all those 5 right there. So that's kind of like the testing as far as that is concerned. So, now it's interesting because, thanks for that slide. I know the doctor wanted to put you on that drug you mentioned. Well, you didn't mention the drug.
I didn't mention it.
Yeah, but we're going to show what he wanted to put you on.
Okay.
And so let's go with these are 2 forms of treatment for thyroid. This is underactive hypo, all right?
Hypo.
Let's go to our next slide at this time, all right? So here we go, folks. Hold on to your seat, all right? Slide coming up on the screen. Here we go. Now, I put the word natural in quotes versus synthetic.
Okay.
So he said, well, he won't put you on the synthroid.
Yeah.
That's synthetic, you know, synthroid,
Okay.
synthetic thyroid, synthroid. That's where the word got his name, all
Okay,
right?
okay.
But wait a minute. The side effects from synthroid, this is taken directly from the label of the synthroid medication. It increases osteoporosis. In other words, fractures of the bone.
Okay.
I mean, it's taking synthroid. Number 2, it also alters your heart rhythm. All right? And number 3, if you are a diabetic, you have a greater risk of trying to get your diabetes under control. This is taking synthroid, the side effects of synthroid. He said, well, what you going to take, Curtis? I said, I'm going to do something natural. Then he said, oh, armor synthroid? Armor thyroid? No. And that comes from the pig.
Yeah. Yeah.
But they call that natural. It's only natural if you're comfortable living in a pig's pen. It would be natural.
Okay.
Yeah, but
Okay.
so a lot of people, I don't want that in my body, but that's natural. So there's the 2 options right there, honey. And of course, we didn't choose either one of those. We chose something else.
You chose something else. Now, it was funny because, thanks for that graphic. It's really kind of funny because what you you said, so he asked you, what were you going to do? Well, really and truly, I know the twain is one flesh, but in this case, I was the one that was having the issues. So
Yeah.
I was the one that was going to be
Yeah,
But
we're in the same room, so he's talking to me too, right?
Once we studied that whole thing, I'm
Yes.
like, Hello? No. Okay.
Yeah, I don't think so.
The answer is
Yeah.
no, I don't think I'm going to do that. Okay.
Yeah.
So what about, so we talked about that, the, natural versus synthetic and what that actually represents, you know.
Natural in quotes from the pig, but
So
it's natural,
I know that they're trying to figure out then what kind of natural things are out there in the marketplace that could also be something that could help us.
Yeah, okay, so let's go with our next slide right here. Here's the third option, folks, all right? Third options. Now, there are many thyroid formulas on the market, and so to make this a short presentation, they are like, based on my research, kind of like the top 2 products. The one on the left is Now, N-O-W, Now, have a thyroid energy formula. Then the one on the right is One Body Thyroid Support as well. The 4 main ingredients based on clinical studies that can support, stimulate T3, T4, etc., is number 1, iodine, and sometimes coming from kelp, that's an herb.
Right.
Number 2, L-tyrosine. Number 3, selenium. Number 4, ashwagandha.
Okay.
These 4 ingredients, I believe, based on research, must be in there. And those 2 companies right there, now it's been rated to be one of the best products out there, because even in third-party testing, what they say on the container is actually inside the capsule.
Okay.
And then One Body, that's probably the best-selling one on Amazon right now. And there also is third-party testing in the lab as well. So those are like the top 2 right there. But both of those 2 right there have all 4 of those ingredients, with a few extra ones as well. So at least people have an idea of what to look for in a thyroid formula. Again, this is underactive hypothyroidism, all right?
I think that one of the things too, and that is that when you're talking about natural alternatives,
Yes.
sometimes people wind up, thanks for that graphic, sometimes people wind up going all over the place trying to find all different kind of things. So I like the idea that you actually talked about the 4 main ingredients that need to be in that formula, and not a whole lot of mix up a lot of different things, but that, and those companies are very good.
Yeah, those 2
and they were the ones that actually helped me as well. So
let's close out, honey.
let's close it out. Let's
got
close
a
it out.
text?
Yes, we do. We have a closing text, and it is found in Psalms 32, verse 8.
Well, let's go to the screen at this time. You want to read it, honey?
It says, I will instruct you and teach you in the way that you should go. With everything we're doing, we need to pray and ask God to be with us, to teach us, to help us. Look back and see what kind of things you might have contributed to whatever's going on with us. But by all means, always pray to the Father for answers, and also always try to get back on that lifestyle.
Yeah, definitely. So that, you know, radiation on the neck, that increases it. Plant-based diet, you can't go wrong with that as well. So as always, John 10:10, Jesus said, I come, that they might have life and have it more abundantly. We'll see you next time.